want to welcome to our big round table. Our first guest today is Dr. Abraham Lichtmacher, who is the Chief of Women's Services at Lovelace Health System. Welcome.
Thank you. Good to be here.
We had a chance to visit before the show. It's a great story. I always like people coming back. You lived here for a while, left, went to upstate New York, where I think you're from, right? And,
the East Coast.
Yeah, and you came back. Glad to have you back.
Great. It's great to be back. I got entrapped.
Yes, you did. Yes, you did.
So what brought you back to New Mexico?
Well, actually, I had worked with Lovelace in the past, in my previous time here, and I was asked to come back and help put together some programs for the health system.
Mm-hmm.
Well, good. We're glad you're here.
Thank you.
All right. This visit today is all about a March of Dimes report about March of Dimes, New Mexico, and a report on premature births in the state of New Mexico. Mm-hmm. And we had a chance to visit ahead of time. The good news is the trend line is down, right?
Yes, absolutely.
And we're seeing fewer and fewer premature births. Where's the concern right now?
Well, the concern is that we still have much too high a number. Most pregnancies go very well. They tend to go the full term, but unfortunately some kids just can't stay in long enough, and they tend to make an early appearance. So the trend had been going up for about 20 years or so. It's been continuously going up, and over the last 5 or 6 years we've seen a decrease in that trend. So unfortunately we're still at about 11.5% in New Mexico. That means 11.5% of our babies are born too early, and by being born too early, lots of problems that can occur with that.
Now, is there a main factor for that happening? Maybe just some people don't have the right resources or not doing the right thing? Or is there a reason, health factors behind that?
Well, there are several. In fact, unfortunately, there are too many things that you can't control, but the things that we can control are getting early prenatal care so that we can identify some of those risk factors and potentially try to treat them. Bad habits, the biggest one of which, of course, is cigarette smoking, which helps increase premature births. And one of the things that we're seeing a lot now, is particularly in light of the healthcare issues that are going on nationally, is the uninsured aspect, patients not being able to get access to their physicians.
Right.
So they're showing up at ERs rather than going to specialists when they need to be seeing specialists.
Or showing up at a point beyond which we can do something to try to prevent some of those births.
Oh, yeah, that would be a problem. Now, talk about this March of Dimes grant that occurred. New Mexico March of Dimes was awarded a grant, and give us the details on that.
Actually, the grant comes from the Kellogg Foundation, which is one of the large charitable foundations, and they awarded they actually do a lot of excellent work, and they provided a grant to the New Mexico chapter of the March of Dimes. It's a little bit under $1 million, and the purpose of the grant is try to educate the public, try to educate the patients about some of the things they can do to reduce some of those early deliveries, such as get in good habits, vitamin supplementation, folic acid supplementation before the deliveries.
Is that a statewide?
No, I believe it's actually going to target 4 counties, specifically 4 counties. Now, I couldn't tell you which 4 counties, but it's going to be
probably
targeted.
the most affected.
Yes.
Okay.
So New Mexico March of Dimes gave us, like we were in school, it gave us a C grade.
Yes.
So often New Mexico gets below a C on a lot of things. So we're average then, in terms of premature births.
And in fact, in this particular case, our C grade is almost exactly the same as the whole country. So the United States as a country has received the same C grade. So as you said, we're probably average in that regard.
So did we move up from last year or move down?
Well, in this case, we moved down, which is a good thing. Our premature birth rate has actually decreased from 11.8 to 11.5%. And
a little bit better,
Yes, and our goal is to get the whole country down to about 9.5%. That's been the goal, the target that has been set.
As I said earlier, you and I had a chance to discuss earlier. My daughter is involved in a lot of this directly. She is a respiratory therapist and works in a NICU at a children's hospital in Florida. NICU is a short abbreviation for intensive care unit for neonatal.
Right.
Yeah. And she tells me about these just tiny babies that they see all the time. but the survival rate is much better than it was 10 or 20 years ago.
Yeah.
Absolutely, and in fact, it's because of our neonatal colleagues and some of the wonderful things that they can do that these really small babies now have a chance of survival and a chance at a normal lifestyle. But the best way of treating the neonatal problem is actually try to prevent it in the first place.
Right.
So it's still an expensive proposition trying to take care of a very small baby.
And have there been more advancements in that area so when that does happen, it's easier to take care of those prenatal babies?
Yes, and in fact, those specialized units, as you mentioned, the neonatal intensive care units that are available. We have one at Lovelace Women's Hospital, and some other hospitals also have those facilities that are geared towards taking care of those very small babies and have the care that's available to them.
Now, those little kids can stay in the hospital a very long time.
Yes, they can. In fact, sometimes they can spend months in the hospital, and you can imagine the cost to society and the cost to the individual parents of trying to keep that baby in that intensive care unit for such a long time.
Because the word intensive implies everything there. The staff is right there all the time, 24/7.
Absolutely.
And
absolutely.
It takes a lot of manpower, a lot of technology to keep track of these little guys and gals and make sure they live.
It does, but the end result is what counts, and the end result is we have some of those graduating, as we call them, graduating small babies do go home, and they finally
it's a big event when that happens in the hospital too, isn't it? When these
Yes, it is. Actually, at Lovelace, we have our annual graduation day where some of our small babies come back, and we have a reunion for them as they have a party for them outside.
That's heartwarming, isn't it?
It is, absolutely.
That is. And now, is there a correlation with the amount of neonatal babies and no insurance?
There is, and in fact, it's one of the 3 areas that have been targeted is trying to reduce the percentage of women in the reproductive age group that are insured. Unfortunately, that's one area where New Mexico, we've kind of had a little uptick in that, and it's hard to know whether this is just part of what's going on nationally or what's happening locally. So that is one of those areas that we target and try to improve.
Okay.
Now, does the age of the mother matter in premature births? Is an older mother more prone to have a premature birth or a younger one?
Well, anecdotally, we always talk about the older mother is more at risk for almost everything that can happen in a pregnancy. But in this particular regard, there are lots of different areas where age probably doesn't make as much of a difference as does previous history, previous premature delivery increase a mother's chance of having another one.
So you're saying if a mother has had a premature delivery once, if she's pregnant again, the likelihood is higher? Is that...
Yes, it is. And those are the patients that we would like to get them into the office earlier so that we can potentially look at those risk factors and incorporate some therapies during their prenatal care so that we can try to prevent that second premature delivery.
Okay. So what are the main ways to prevent premature birth?
Well, the first one is to plan your pregnancy, and don't let it be an accident. Plan if you can, and most important is to try to get onto a vitamin supplement, specifically folic acid. There are lots of foods that are fortified with folic acid, but you can certainly get it over the counter. That helps reduce some of the birth defects that we see that can also contribute to premature births. And then getting in to see your doctor early so we can identify those risk factors and potentially treat some of those things to try to reduce that. And last but not least, as I said earlier, the big one is get yourself into good shape and get rid of those bad habits like cigarette smoking. 1 out of every 5 of our patients still smoke, unfortunately.
Oh my gosh. And
1 out
that's
of every
people
5.
with child?
Pregnant women,
Oh my
yes.
gosh. That's a startling number.
In this day and age, you'd think,
Yeah. I actually, I remember years ago I heard that it's actually still legal here in New Mexico to smoke in public and be pregnant. You can be 9 months pregnant and smoking.
Oh,
and that's perfectly legal. It's amazing.
It's a doctor's nightmare.
It's awful. I don't understand.
Is the info on this March of Dimes report available? People can read it and find out more about this study. I think it's good news for New Mexico. That we're making steps in the right direction.
And it's actually available publicly, so you can go onto the March of Dimes website and actually see the listing of all of the different states and how they fare in terms of the report card, because the report card is given nationally.
And I think this is great because one of the biggest factors is knowledge. If people don't know about unfortunately, you think it's, oh, well, of course it's easy. You should know what to do when you're pregnant.
Yeah.
But not a lot of people do. And especially if you get pregnant at a young age, they don't have anybody helping them.
Yeah.
So this is great. This is awesome.
Yes.
Doctor, thank you. I've enjoyed this visit. It's been great to learn more about this with you. And welcome back to New Mexico.
Thank you. Thank you for having
Yeah,
me.
thank
Thank you.
you.